So we're going to take a jugular blood sample from our patient today for her pre-anaesthetic blood test, which, as we know, is going to test her liver and her kidney values. It'll also check her blood glucose, and it'll also do a full CBC or complete blood count for us. So we've got prepared what we need to in advance. So I've got my quiet cordless clippers ready. I've got a needle and syringe. I've got my 2 blood collection containers. The first one is our little LITHEP tube, or UFO as we call it, which will go into our IDEX machine, and we also have our EDTA anticoagulant tube for the CBC. I've also got a catheter in here, we'll pop that in later. I just gathered everything we need at once, and we also have some chlorhexidine alcohol swabs ready to go. As you can see, our patient is a little bit nervous, and so we have just prepared with a little towel wrap, which maintains our safety as well as her safety. So we'll see how we go, even though we've got a little bit of a nervous patient. I'm just going to prepare my needle and syringe, and as always, we're going to do that in an aseptic manner, so I'm peeling my packets back rather than punching through, attaching the needle and syringe. Just make sure the bevel is upright, and we are good to go. So anatomically, remember the jugular runs from the base of the ear down into the thoracic inlet, which is just medial on the shoulder, and that is where all our external structures enter into the thoracic cavity. So we expect the jugular to be running in this direction, and so that is roughly where I'm going to clip, just a nice little rectangular clip there in order to prepare that vein. We don't want to mess around too much with this clipping. It's quite a stressful process for these cats. So just 1 or 2 swipes up should do the job. With a nice flat thumb down on that chest, I'm just going to apply some pressure to occlude that jugular vein, and I'm just going to wet the skin with some chlorhexidine alcohol, which also helps that vein stand up and become visible. Okay, you can actually see here we've got quite a medial vein, so it's actually sitting, you can see the little raised vein there. If I let that go, the vein relaxes down. If I occlude it, the vein stands up again. If I'm unsure, I can just use my finger to have a little feel, and I can feel, yes, that definitely is the vein sitting there. So I'm just going to grab my needle and syringe, just going to pop into the vein. They can move around a little bit, so we need to work with it. Once we're in, nice steady needle and syringe. Once we've got enough, let the vein go. I'm going to pop some pressure on there, and I'm going to put 0.7 of a mil goes into my LITHEP pot or up to the line. And then I'm just going to give that a little swirl to mix the blood and the anticoagulant together. And the rest will go into my EDTA tube, ready for the CBC to be run.